Hi, welcome to week 6. You now have the symptoms urination, nausea. Yes, now you can feel the pregnancy. You're in month 2 of your pregnancy. You will have these questions in mind. How is my baby developing at 6 weeks? What will my baby look like? What should I eat at this time? And what are the signs of miscarriages? And some guidelines for medication. Let's look at these questions in detail now. The baby has started looking like a baby now. It's taking its shape. The embryo is the size of a lentil, about 2 to 4 mm this week, and your fetus has an oversized head in proportion to its body. But the embryo's features are forming with small little spots. The eyes, ears, and nostrils will be forming at these spots. These are buds protruding, which will become the arms and legs and are getting more noticeable now. The embryo's hands and feet look like paddles. You can't hear it yet, but the heart, which has divided into the right and left chambers, is beating at about 150 beats per minute, twice the rate of yours. Isn't that exciting? At this time, your baby is most susceptible to factors that can interfere with the development of the fetus, and also most of the malfunction develop at this stage. The liver develops before the rest of the digestive system. The neural tube is now closed over and the brain is developing at one end. The appearance, your baby now resembles a tiny seahorse. She's now floating in a bubble of fluid, which will develop into an amniotic sac. The large head looks out of proportion to the body only because the head is developing rapidly. So please don't get carried away by this photograph. Halfway through this week, the embryo makes its first movements, though it will be some time before you can experience your baby's movements. Remember that this is a very important time in the development of your baby's organs, and it becomes imperative to avoid alcohol, drugs, and treatments like perming, hair coloring, manicures, etc. All the symptoms are exaggerated if you have twins or triplets. Be sure to drink a lot of water to relieve you a little. Let's talk about nutrition. Take a diet rich in vitamins, minerals, fiber, and fluid apart from the normal calories, like whole grain bread, rice, pasta, and rice at least 6 servings per day. Fruits at least 3 servings per day. And vegetables, please try to take at least 4 servings per day. Meat and other protein sources, you could have 2 servings per day and that could suffice. Dairy products, at least 3 to 4 servings per day. Fats and sweets, at least 2 to 3 servings per day. Try to take all of this for your nutrition. You may not be able to take these items if you're suffering from morning sickness. Remember that. Morning sickness will not let you keep the food down. Now, here are a few tips. Be sure to drink lots of fluids and take a rich diet. Try to keep some non-spicy snacks or biscuits by the bedside and eat it before getting up in the mornings. Eat small meals at frequent intervals and do not let your stomach go hungry. Listen to good music, practice your religion, and do exercises and yoga. All discomfort may not be morning sickness. Be careful. This is also the time when some of you may show bleeding, which may or may not be normal. It will be wise to show your doctor and rule out miscarriage. Tests for pregnancy. X-rays and other imaging tests. The possible pregnancy tests you will go through is a physical exam, a pap smear, breast exam, rubella titers, blood type and Rh factor, HIV, hepatitis, and cystic fibrosis screening. These are some of the tests for pregnancy that you will be going through. Now is also the time for your first visit to the doctor. Apart from all the discussions that you can have, Your doctor will also like to know about all the medications you're taking and also if you're suffering from any medical problems. You may also be asked to go for certain tests. Now, guidelines for medications, because you will be taking some medications during pregnancy, it is better to play safe than to be sorry later. Some guidelines for medication use while you're trying to get pregnant include the following: take your prescription exactly as the doctor has instructed you to do so. Do not use medications that were given to you in the past. Do not use medications according to your judgments. And don't use anyone else's medications. Always consult your doctor before trying a new medicine that you're unsure of. Daddies, here's a tip for you to support your partner. Cook her favorite meal. Give her your support if she's suffering from nausea or morning sickness. She needs you there. Be there with her. Thank you.